This case has excited me so much, I am making two consecutive videos on it because it speaks to something that is not discussed about Invisalign enough. We know Invisalign's removable and comfortable, and you can eat whatever you want, you can floss your teeth, it's invisible. We know all that. But what only the real Invisalign expert doctors know is how unbelievably efficient a treatment has the potential to be under the right circumstances. And let me show you. And I fully am aware that any orthodontist can pick one case that they treated and try to make bold claims, but this does show the potential of what aligners can do. This patient came in on the left here with moderate to severe crowding and protrusion, narrow arches, difficult rotations, which is sometimes considered, I think unfairly, a knock on aligners. So look at how that tooth is rotated 45 degrees, and look at this area over here. Now this here was my ClinCheck, 30 active aligners. I didn't even use a lot of attachments, none on the front teeth. This was my plan, and my teeth were supposed to arrive at a destination, something like this, by the 30th aligner. And what I mean by something like this, Invisalign is very confined. The teeth do not go in unexpected fashions. They don't go awry. That's what happens with braces, because braces, we're using our eyes and our hands, and there are various factors involved. Invisalign is very controlled, but I will concede that the average Invisalign case requires, it will complete about 80% of the job, meaning that if you complete a case, let's say with 6 months of aligners, you may need another 2 months in what's called refinement, because usually after one batch of aligners, the teeth don't get to this position because the teeth are not clamped to the plastic. What you're looking at is the exact shape of the 30th aligner. So inside that aligner, you hope the teeth will look like this. But if I backtrack a little bit and I show you this, maybe we get to a point where this tooth still looks like this, and this looks like this, which is a lot better than this. But we still may need more aligners in what's called refinement to go from something like this to this. Well, in this case, I saw the patient twice to deliver the aligners, and then I saw them 15 weeks later. And they came back just the other day, and this is where they are. I had to look a few times to just try to make sure that I was looking at the first stage, which is off of the scan. It matches exactly what I did. I broadened the arch. Look at that arch broadening. And you know, Invisalign is great at broadening the arch. It doesn't have to broaden the skeletal arch. It doesn't have to broaden the intermolar width, but the muscles of the face narrow the anterior arch over time. And look at how great this looks. And on the lower, remember this difficult rotation of number 26? Look at it here. This is how it landed after this. And so what's remarkable about this, and I didn't use attachments on this. So an expert Invisalign orthodontist has to know what sequence is involved in moving these teeth. And as more and more orthodontists get experience with Invisalign, they're going to learn it too. I teach this. I mentor other orthodontists for Invisalign on this. And once you have that, and once you have a compliant patient, and by the way, compliance requires a very important set of messaging to the patient. You don't just say, wear these all the time and goodbye. There's a nuance to it. But the point is, in 6 months, this case is essentially complete. And a few things that I've got to, I wouldn't say vent, but really say what isn't said enough. When an orthodontist finishes a braces case, because the brackets are placed by hand, placed by eyes, I can concede to you from personal experience when I remove braces from patients, and there are some people who still only want braces. I'm about 80% Invisalign now, but those 20% of cases, when I remove the braces, I have looked at it with my eyes, I have approved things, and it looks great. But when you put it under the microscope like this, it does not look this good. And everyone's happy, the braces are off, the smile looks nice. But, you know, think about it, artwork, when you're looking at a painting, it's the little details that make things pop. You got to get every tooth perfect. Now, the most expert orthodontists, they are craftsmen, and they will make the painstaking adjustments on those braces to get every tooth to look like this. But guess what? That takes a lot of adjustment and a lot of time. If you are a parent out there, or if you had braces yourself as a child, how long did you have your braces on? I bet the answer was 2 years. Why 2 years? because it takes 2 years sometimes to nail it, because the art of adjusting the braces is it's becoming archaic. It's a reactive process. You titer it, you eyeball it, and it's not exact. You close a space here, you open up a space somewhere else. So what's happened with Invisalign is you are setting the tooth positions, and the teeth will follow those tooth positions. And even if it falls short of the mark, it's always confined where it needs to be. So this treatment is basically, I don't know that I'll even need to do any of the prescribed refinement. I might remove the attachments and finish it at this point. It looks that good, and the occlusion is still great. And you could not do that with braces to this level in 6 months. You just can't. And so this is changing orthodontics. And it's an issue because some orthodontists, they don't want to relent. They don't want to give up the craft of braces. They love what they do. Or they think people expect them to make all these adjustments and sit there and kind of, let's just say it, look like they're doing something. I have mastered the communication to tell people I'm going to spend time on the plan, and then you're going to wear the aligners, and you're going to come in half the amount of time or even less than you would with braces, with no pain, no poking, no breakage, better hygiene, and we're going to get the result faster. And people say to me, I thought braces was faster than Invisalign. It's faster out of the gate. The teeth will look straighter. If this person got braces in 2 or 3 months, it would look straighter. But this is like the turtle that wins the race against the rabbit. This is staying on the course. This thing is all over the place when you use braces. And so I'm just showing you, yes, it's one case, but we have lots like this that show the treatment time much less with Invisalign, even in complex cases like this.